This is a really special one. I did a longevity learning series here from January to March. And we didn't get specific on a topic. So this is our first time to get really specific and hone in. And then over the course of the year, we'll also see how many more individuals are interested in learning more on very, very niche specific topics. So thank you for being here. It's also a very special one because I have a special guest named Steph. And we're really excited about this because this has been a long time coming.
Yeah.
For years that we had thought about this lecture. So you're going to hear from me, you're going to hear from her, we're going to have a fireside chat afterwards so you can also ask some additional questions. We'll talk about testing, and so we're going to get into it. Everybody ready? Yeah? All right. Disclaimer, it's a pretty standard disclaimer. This is for informational purposes only. Take what you want, leave what you want, and also make sure you talk to your doctor about anything that you learn here that might also apply to you and your health. And this is us. There's me. I'm Dr. Jaclyn. I'm the lead functional medicine physician here at Love.Life. I'm also a board-certified family medicine physician. I am a functional and integrative medicine practitioner and a breast cancer survivor. I specialize in hormone optimization, and the reason why I love hormones is because it is applicable to everyone, to all of us, to those of us with PCOS, those of us with other things going on, or even nothing at all going on. And then we have Steph. Do you want to say a few words?
Yeah, sure. Hi, everyone. Thanks so much for coming. I'm Steph. I'm a certified nutritionist and personal trainer, and I founded Simplify PCOS. So I work with women like us who have PCOS, so specializing in hormones, nutrition, and strength training.
And how do we know each other? You can tell them.
Well, first of all, I owe a huge thank you to Dr. Tolentino because she is the one who helped me finally figure out what was going on in my body and help me get to the root of my PCOS. So she was my doctor back in 2017, 2018, long time ago, and has been a really important part of my life.
Thank you.
Thank you.
And this photo is such an interesting one because we took a quick selfie outside of Great White. Are you familiar with Great White over in Venice?
Yeah.
And so we were standing over by the sign, and that's my husband, Charles. And we were like, you know what? Wouldn't it be great at some point in the future if we could ever do an event together? That would be really great if we did a webinar or did a presentation, and here we are. So we are bringing this to life, and now we chose this particular topic because of our own personal experience. So that's really what brought us together today. And why are we doing this? Why are we doing this at all? We are doing this because of these particular stats. We know that 1 in 10 women of reproductive age are affected by PCOS globally. We also know that this is a big one. Up to 70% of women with PCOS remain undiagnosed. We also know that PCOS is the leading cause of ovulatory infertility, yet it's also linked to so many other conditions, including type 2 diabetes, including cardiovascular disease, and also anxiety and depression and mood disorders. So this is why we're having this conversation. And I've heard it referred to many different ways, but some people say PCOS. I've heard people say PCOS.
That's a big one.
Yeah. And this is just a very simple definition of what PCOS is. It's a hormonal and metabolic disorder that's characterized by a group of different symptoms. And most commonly, the hallmark or one of the hallmarks is this irregular periods. And then secondarily, the development of small fluid-filled sacs in the ovaries. And so traditionally, that's how it was defined. Some patients will have zero bleeding whatsoever. Some will have irregular periods, meaning not happening every month, or skipping, or spotting in between. Somebody could have a period every 30 days and still have some spotting in between. That might be a sign of irregularity. And then we've got these signs of high androgens like excessive acne. And that's not just here on the face area or the jawline. This could also be the chest. It could also be the back area. Excessive hair growth in some places, and then hair loss in other places. And then we've also got the polycystic ovaries, which is very classic for why this was originally called that, where people do have cysts that develop here or cause enlargement of the ovaries. And I like this because separately from those irregular cycles, separately from the cysts that will develop or even those androgens, you can see that it's also related to these other conditions, like having a fatty liver, which is really fat that forms around the liver on the outside of that. Blood sugar being highly dysregulated, which is pretty big. We're going to talk more about that. Problems with sleep. Noticeable changes with how you sleep, whether or not you're well rested. Are you noticing that you're fatigued and dragging during the day? Are you struggling with mood swings? It's not just anger and irritability, but it's the highs and lows. And are you somebody who's struggling with weight changes on both ends of the spectrum? How the leading medical societies define PCOS. I put this slide in here specifically so that you could see that over time, whether you're starting in 1990 or all the way over here to the International PCOS Guidelines in 2023, there were some updates that were made. And this is helpful for clinicians to diagnose PCOS, which is really that syndrome of different things that are happening. So way back in the 1990s, it required both high androgenism, which is really high levels of testosterone and the presentation of things like acne or the excessive hair growth or the hair loss or thinning in certain places, and the irregular periods. And at the time, they also said that if a person did an ultrasound to look for cysts on the ovaries, this was not required in order for someone to be diagnosed there. And then fast forward, fast forward to 2003, you can see that if any of the two were present, if somebody had the high testosterone and the skin symptoms like the acne, and they also had an irregular period, and they also had these polycystic ovaries where the cysts were forming on the outside, and then of course the doctor had ruled out other causes, you could then be diagnosed with PCOS. This has traditionally been the criteria for PCOS back in 2003, but even to this day. Practitioners are still using this same criteria, and there have been a couple of changes along the way. In 2006, they also said that the high testosterone is one, and that they either have to have the irregular periods or they have to have the cysts on the ovaries. And then they even updated it again in 2023, where if you were an adolescent, meaning that you were under the age of 18, and it had actually been at least 2 years after your menstrual cycle, they had their own criteria that was very specific and different for patients who were younger. So, as a fact, we know that you do not have to have cysts on the ovaries to be diagnosed with PCOS. It is one of the three, but it doesn't mean you have to have them at all. You'll have some patients that don't have any cysts at all. I like this slide because it just talks about the importance of learning about this as a diagnosis. And in one study, almost 50% of women had to see 3 healthcare professionals or more before being diagnosed with PCOS. So it can take, at least from what they found, and this is a study from 2016, 2 years and at least 3 or more doctor visits before being diagnosed. I know that there are people in this room who have seen doctors, and it wasn't just the one-time visit automatically got diagnosed, that maybe there are people in this room where you have seen multiple doctors or had to see multiple doctors about this before anybody ever mentioned that this could be a diagnosis. And most PCOS symptoms, we always think about just those 3 criteria that I mentioned, whether you've got the acne and the excessive hair growth in some places, and you have the irregular cycles or you have the cysts. But when you look upstream, it's actually inflammation and your blood sugar not being stable, and stress, and a poor lifestyle, and even imbalances in the gut microbiome that are also contributing to why people have this condition. So when I see a patient here at Love.Life, these are some things that I'm thinking about. So some of the first things that I'm going to ask are about the menstrual history, because we talked about how one of the very first things really is the irregular cycles that people have. And then we're going to look at your menstrual diary or a tracking app. So documenting how often you actually have menstrual bleeding. Are you having any other symptoms? Do you notice any episodes of spotting? Those things are quite valuable and very important to help me understand what's going on. Have you been on any sort of birth control? Because many providers are also prescribing that. If you have, what kind and how long? And when did you start, right? So there's lots of questions there. If this is applicable, some patients have had a history of difficulty conceiving. We know that PCOS is one of the leading causes of infertility. And so thinking about, have I been trying to conceive? And if I have, how many months has it been? Could this be a possible diagnosis that is applicable to me? And then this concept of hirsutism, which is really the excessive hair growth that people will notice on certain areas of the body, mainly here in the chin, sometimes on the cheeks and the lower jaw area, but also on the belly and then also around the nipples. People will also notice some darkening of hair there, and that's what we call hirsutism. Acne, especially here. Most of the time, you'll often see a lot of hormonal acne that's present in the lower half of the face. It's very common. And this is a big word for darkening and pigmentation changes that'll really happen here under the armpit areas, or sometimes in the groin area. You'll see it there, or here around the neck. We talked about how sometimes it's excessive hair growth in those places, but then you also see hair loss and hair thinning. So for some patients, this is also hair thinning on the hairline of this particular area across the face, or even they'll notice it from photos. If you look at pictures of yourself when you were younger to you're older, they might notice also some changes in their hairline as well. So those are some things that we'll see commonly when I'm asking and talking about a history and physical exam and looking for additional information about it. So PCOS, here's how it can show up. We've talked about the irregular cycles, the fatigue or brain fog, mood swings, blood sugar imbalances, really having trouble losing weight, and also having trouble gaining muscle, and inflammation or acne. I talked about how downstream, this is blood sugar dysregulation, this is inflammation, there are other issues. And this is a real life photo, right?
Yes, this is a real life photo of me with the acne. And it's actually not one of the worst ones. Where I had acne for 20 years, 20 something, and I wouldn't let a camera near me, at least without makeup or filter. So I wish I had more photos to show you.
Yeah.
But this was me. And then I also personally struggled with PMS that I could just summarize in one word as insanity. I'm sure that feels relatable.
Yeah.
Was hairy. I always kind of blamed it on being Italian, but I think I just got the double curse with the PCOS. And then a lot of symptoms I see with my clients are difficulty losing weight, especially in the midsection, and a lot of GI issues, so like bloating, just having trouble digesting, and then other ones like fatigue. Mm-hmm. Fatigue's a big one, especially crashing midday. So yeah, symptoms that can show up in addition to these.
Yeah, and I remember you saying that you wouldn't allow a camera around you, but there were some times or some moments where the acne was actually really bad, painful, cystic, etc.
So bad. It actually consumed me. It was what I was like determined to figure out every day. And when we did resolve it, I almost was left wondering what I should be hyper-focusing on now, because it was very, very consuming.
Yeah, thank you for sharing. So some of the common lab markers that people will often use or see traditionally, this is an example, and I know the font is like a 5-point font and no one can barely see it, but we'll try to make sure that we can zoom in or have a version of that when the video and the recording releases. And what you'll see is there are markers that are related to androgens, which is production of the testosterone, etc. We're also looking at hormones that are signaling from the brain, like prolactin. We're looking at the thyroid, the blood sugar, and even a cholesterol profile, because patients who have PCOS will often have some changes in their cholesterol as well. And that is a very tight list of labs that are commonly used by either OBGYNs or even family practice or internal medicine doctors that will commonly test that. you'll see that there's a bit more to the story and a bit of a difference when we're also looking at it from a functional medicine lens. Here are some traditional treatment options for PCOS. Birth control is probably at the very top of the list as some of the things that most doctors are going to recommend patients to be on. You may often hear about metformin as well. Metformin, and of course I put there, used to improve insulin sensitivity to help regulate blood sugar. Spironolactone is often used for patients who are really struggling with a lot of the acne. Sometimes patients will be put on fertility medications. And then the bedrock is to always make sure that we are focusing on lifestyle, and we'll get into that. But when I look at that list, sometimes it's enough. And some patients feel okay, they feel fine with being on them. And then I have a lot of other patients that are going to come to see me because it's not enough for them. And maybe they're still struggling with symptoms. Or maybe them being put on certain medications have more side effects that are creating more problems for them. And so for those people where it's not enough, that's why there's opportunities and solutions that we have that just broaden the scope and broaden the toolbox. And it's okay to have that, right? So maybe you're somebody who feels really comfortable on being on birth control, and you're here because you want to know if there are side effects to long-term use of birth control and what effect that has. Or maybe you're somebody who is on the birth control and you're like, you know what, this hasn't been helping. I'm still really struggling with weight gain. I notice that my acne is not getting any better, and I probably do have some blood sugar issues. So what is functional medicine? Many of you might know or might not know about what functional medicine is, but the whole purpose of functional medicine is to help people focus on the root cause of why they're sick. It's not enough to just diagnose somebody with PCOS and just say, okay, this is your diagnosis, here I'm going to put you on birth control, and that's it for many months, if not years. Maybe that's not enough. And if it's not enough, there are other tests, there are other ways of looking at it, there are collaborative opportunities where you can have different kinds of solutions, and that's what this is about. So a functional medicine approach to PCOS doesn't just look at the root cause, we don't just treat symptoms. There are personalized labs that are being tested that go beyond what we commonly see in traditional medicine. We also recognize that nutrition is truly the bedrock, and Steph's going to get into that later to talk about what's really important from a dietary standpoint to support patients with this. We also know that stress is a huge contributing factor. You may have heard me talk about stress and hormones before in another presentation, but these things don't work in a vacuum. Stress and different kinds of hormones, they have a synergy and they all work together. So if we are highly stressed out, you can be sure it's affecting not just your period cycles, it's affecting your thyroid gland, and it can also affect your blood sugar regulation and beyond. We also think about it as a whole person, right? It's not just, hey, let me pinpoint on this diagnosis, but is this person struggling with inflammation? Are they struggling with a gut microbiome that is overgrowth of wrong bacteria or not enough HCl to support how well the stomach and the digestive tract is going to absorb nutrients? Maybe that's the problem. Maybe we need to think about it a little bit differently so that we can have a more holistic solution. And remember the list of tests that I showed you that are commonly tested for PCOS. You'll see that tests that a functional medicine doctor might consider is some of these. It doesn't mean that this is all of the tests that we would typically get, but these are some of the ones that I would get. I do like to look at lots of different hormones and not just the 2 or 3 that you saw on the list. I also think it's important to look at the entire thyroid panel, not just the signal between the brain and the thyroid, but how well that thyroid gland is outputting hormones to the rest of your body. I think these markers are important, like anti-Müllerian hormone. I'll bring up in another slide. It's a really interesting one, but for many of my patients who have PCOS, it's something that's been very helpful in order for me to monitor when they're not able to get an ultrasound as often as I would want. Over here, you're seeing fasting glucose and insulin levels. You're seeing comprehensive metabolic panel to look at your liver and kidney function, and even leptin hormone. So these are just examples of other tests that are related to PCOS and inflammation and blood sugar metabolism that are helpful. And then the list continues. I always think that it's important for us to look at nutrient levels so that we can see how well those nutrients are helping all of your cells work. Because if your cells don't work well, then your tissues can't work well, and then your organs can't work well. And this is part of the reason why people are also struggling with imbalances. And then over here, specialty testing. I'm going to show you an example of Steph's test. And we took a look at how her body was metabolizing hormones. For some people, the stress is so severe, and some people love data. And so you can look to see how well your body is metabolizing certain hormones like cortisol or like estrogen. And those things can be very important for certain individuals. Gut microbiome testing. I mentioned that earlier, that some people do love to look at how well the ecosystem of their digestive tract is truly working. And there are some tests that offer some additional data there. And then things like the continuous glucose monitor. A lot of our members here at Love.Life are offered one, not if you just have diabetes or if you have pre-diabetes, or maybe you're just interested in learning about your body, because you can see what happens whenever you eat certain foods and how well or not it rises and falls when you're looking at your blood sugar, and what are the patterns there. And so I'll often tell people to always use 2 CGMs. The first one is to see what your body naturally does. And then the second one is to implement some strategies that are then focused on the recommendations that are made from the first CGM. I mentioned I was going to talk about AMH, so here it is. Anti-Müllerian hormone, secreted by small antral follicles inside the ovaries, and it's often 2 to 3 times higher in women with PCOS. And you'll see that in 2023, that's just a couple years ago is when it started to be recognized. I've seen many, many PCOS patients who have exactly that. And even though it wasn't one of the main criteria, it wasn't part of the irregular cycles or the cysts that were present, I still found that checking an AMH level was very valuable so that I can also see if those markers were improving. The easiest way for me to talk about this particular marker, since it's found on antral follicles, is I like to think of inside the ovaries, there's a cluster of grapes. Picture in your mind a cluster of grapes. And on the surface of the grapes is where you're going to find anti-Müllerian hormone. So if you've got a really, really big grape cluster, you're going to have a lot of hormone. And if the cluster of grapes is small because maybe you ate it all and now you're down to the last 3 grapes, you'll notice that the anti-Müllerian hormone number goes down. So in a lot of patients that have PCOS, it is one of the markers that more recently has been recognized as something that is very helpful when it comes to diagnosis or treatment or monitoring for PCOS. And when we think about functional medicine and how different our approach is, these are just really the main pillars. Looking at blood sugar, looking at insulin. We talk about hormone balance between all of the hormones. We talk about gut, your gut microbiome and inflammation. We also talk about stress and sleep and making sure that you're moving your body. And now we're going to get into some lifestyle optimization tips from Steph. Yes.
This side, actually. Okay, so lifestyle really influences the way that we can manage our PCOS. The method that I like to use with my clients focuses on 3 pillars. So our nutrition, our movement, and our stress and our rest. And these pillars are key to simplifying PCOS. So at first, diagnosis can feel overwhelming, but we really can simplify by just focusing on a simple lifestyle. Nutrition in real life. So what does this look like? Nutrition is what I use as our foundation. And so to really stabilize our blood sugar, we focus on 3 meals and 1 snack per day, not skipping meals. So staying consistent with our meals and our meal timing. And then at every meal and snack, I like to prioritize protein, fat, and fiber, again, to really help balance our blood sugar, which is one of the root causes that we talked about. What we eat is really important. So it's not just a matter of how much we're eating, but it's more of what we're eating, so what the diet really is composed of. So I like to focus on the anti-inflammatory foods so that we can cross off another one of those root causes, which is inflammation. And then One really important takeaway here is to not overthink it and to really focus on consistency over perfection. Nutrition will never look perfect, and it doesn't have to. Some examples of inflammatory foods. So just picture whole foods. So if it's from the earth, it lives or it grows, it's usually fair game. Some of my favorites are the leafy greens, so all the healthy, colorful vegetables, organic berries, wild-caught seafood, so it's high in the omega-3s, which are anti-inflammatory. Dark chocolate is a good one, and it keeps it more exciting. Healthy fats, so like avocados, extra virgin olive oil, turmeric, and then green tea is great to drink throughout the day. Some probiotic foods. So when you hear probiotic, you probably think gut, and gut is very central to all things health. So a healthy gut just helps keep your PCOS managed, keeps us healthy. So probiotic foods, which help feed the good bacteria in our gut. Yogurt, especially I like coconut yogurt. I like to stay away from dairy. Kefir and kimchi, sauerkraut, miso, tempeh, and pickles. And then in order to feed those probiotic foods, we focus on prebiotics. So dandelion greens, chicory, I actually never know how to pronounce this, endive, radicchio, leeks, sunchoke, onion and garlic. Those are great ones to cook with. I cook with them in almost every single meal. Asparagus is a good one, banana, and cocoa.
So we put this disclaimer up here because we're about to talk about supplements and vitamins and herbs and nutrients. And I want to make sure that everybody realizes that nobody would be on all of these things at once, but they might be something that their clinician might think about when they're looking at this particular individual and their history. So here are some examples of what you'll often find to be helpful for patients who are struggling with PCOS. You'll see that the B vitamins are on the list. One of the rock stars for PCOS that is commonly used are the inositols that are listed here. Really part of the B vitamin family, but technically it is a type of sugar. And we know that it's very effective to help support insulin function, help with how your body's metabolizing cholesterol, even high triglycerides. It can also be helpful for blood pressure and even ovulation. Sometimes I'll find that patients are really low on some of these more important nutrients, and they do need to have targeted amounts, not forever, but for a certain amount of time. And at the same time that we're really optimizing with certain vitamins and nutrients, we are focusing on what they eat, and we're focusing on how things are being digested. Here's another list. So the list goes on, and you can see that I categorize them. Here we've got antioxidants and anti-inflammatory support. Things like N-acetylcysteine, we know that's the precursor to help your body make glutathione naturally. Earlier, Steph had mentioned turmeric, so you see curcumin on the list. Green tea extract, again, green tea is great, but then some patients will also be recommended to use the extract for more hormonal regulation purposes. And things like berberine. So you'll often see berberine to be used instead of metformin. Examples of Steph's top 5 supplements for PCOS. Back to you.
Okay, so we have some repeats. Inositol is the brand name, but again, it's just an inositol blend. That's probably one of the most common for PCOS. Very effective. I really like magnesium. Great for sore muscles, but also relaxation and stress management. So this is kind of a nice one across the board for nutrition and training. Berberine, I can't remember if we mentioned it in the other slide, but it's also very commonly used, great for blood sugar. Vitamin D and K2. Vitamin D is an important one because I find most people to be low on it, and it's great for just hormone production, mood. It's a big one for mood, immune health. This is another really common one that I like. And then DIM, for me personally, is probably my number one. It's what really helped with the acne. But another one that's great for PCOS because a lot of times women with PCOS have high estrogen. They can be estrogen dominant, and it just helps us detox those toxic estrogens.
And now the list looks different for you.
Okay, so now the list looks way longer. This is what I just restocked my supplement list. So one important thing to note is I don't take all of these all the time. I like to use supplements kind of as needed or in cycles. And so one reason I revamped my list is because I wanted to just make sure that I still really like all of these because I recommend them to my clients, and I've also had personal success with all of them. So one thing to note is I don't take all of these all the time, and that's not an expectation. So some that we've already listed, I'll go through the ones that we haven't talked about yet. Collagen protein, I like it because it's a great way of getting your protein higher throughout the day. So like I said, you kind of want to balance your meals, protein, fat, fiber, and we don't always want to be eating chicken, salmon, steak, some animal products. So it's a nice way to kind of sneak the protein in. It's also great for your gut and your gut lining. Magnesium I do before bed, so it's really calming, helps you sleep. Liposomal vitamin C, so powerful antioxidant, and again, it supports that proper estrogen metabolism and immune function. Here are the two for the blood sugar that we talked about already, the berberine and the ivositol or the inositol blend. Same with vitamin D. Glutamine, that's another one that I really like for like the training fitness world, meets nutrition, because it helps with sore muscles, but it's also great for your gut lining. Zinc's another one, great for hormones and hormone balance and for skin inflammation and to help support ovulation. DIM, my favorite one. And then this is a probiotic. The GLP-1 doesn't have to be specific, but this is actually new. I just tried it to see how it works, but good for the gut, and then also to help with appetite control. And then a progesterone cream is the last on the list that we haven't covered yet, but I personally love to use it to just help support that estrogen-progesterone balance, because I mentioned just being estrogen dominant.
So here's what this looks like in real life for Steph in terms of training and lifestyle.
Yeah, so movement is our second of those three pillars that I like to focus on. So nutrition, movement, stress management. So movement in real life, it doesn't look like overtraining, doing excessive cardio, and killing ourselves. Instead, it's moving for your body and for your hormones to function optimally. So that looks like strength training, only 2 or 3 times a week, doesn't have to be every single day. Focusing on our daily steps, so hitting anywhere from 6,000 to 10,000. Like I mentioned, no overtraining, no cardio obsession, because if you picture too much training, it's actually a stressor on your body, and that's one thing that we want to minimize. And then we're focusing on building strength and not just burning calories. So strength is great for metabolism and hormone function. So yeah, think strong and not just trying to burn away calories. And then most important to take away from this slide is that rest days are productive. They are just as important as training days, and it doesn't make us lazy because our body needs rest to recover. Pillar number 3 is our stress management. It's way easier said than done. Managing stress in real life is tricky, but it's one of probably the most underrated pillars because it is very important. So stress management in real life looks like prioritizing our sleep, so aiming for 7 to 9 hours per night. In order to help that, it's great to have a good nighttime routine, so it allows you to wind down, go to bed, try to go to bed at the same time every night. Incorporating something simple for our nervous system every day, so that could look like breath work, journaling, meditation, even lying on the floor with your legs up on the wall for even just a couple minutes, or taking moments out of your day to stop and take a few deep breaths really makes a big difference. Saying no more, so setting boundaries with work, with workouts, with people, so that we prevent not doing things that we don't want to do and then putting ourselves into a state of stress. And then again, just really honoring our need for recovery because it really is a big part of healing.
So we wanted to make sure that this particular presentation was a little different. And thank you, Steph, for allowing us to see an example of what a Dutch test looks like. This is a urine test. This is done at specific times. You can see that this was a test for hers that was done back in 2019. Mm-hmm. And when you look at it, it looks like a lot. It looks really overwhelming, and that's why it's always important to work with somebody so that you can understand it better and you can go over things line by line. Now, when results come back for patients who've completed a Dutch test, they have it written here in terms of all of the different metabolites. And while we don't have time to go over every single aspect of her test, I'm going to show you some of the most important things. Over here, you're going to see 8 different androgens. We know that androgens are part of that family that are going to create the testosterone, which then creates the acne and the excessive hair growth and the hair loss in certain places, and can also contribute to the irregularities in the menstrual cycle. So this is why we're looking at all 3 of these. We're looking at the metabolites in the urine of how her body was creating progesterone, how it was creating the different kinds of metabolites of estrogen, and then also looking at those androgens, because a lot of the symptoms that Steph had were likely related to some of that. Now over here, what you see is that there are certain ones that are above the range, including dihydrotestosterone here. And whenever this one is elevated, it commonly presents with the acne, with the oily skin, with excessive hair in these certain places. And so you can see that that kind of does match up, that her level is elevated there. It also shows us some of the inactive metabolites of testosterone that might not be as important. But if you just looked at this picture, you may just check the boxes and say, okay, a lot of Steph's markers are, her speed dials are in the normal ranges. And that's not really enough information. We have to look at the fact that her body was also metabolizing a lot of the testosterone here, even though this level is in the normal range. So sometimes people will see a doctor and maybe they're going to get the regular blood work done. And with the regular blood work, you'll often see this normal. Yet this person might really still be struggling with some of those high androgen type symptoms because their body has metabolized a lot of that testosterone, and you can see that here. Over on this side of the picture, a lot of these are being produced by the adrenal glands and also downstream effects of the liver. So basically this is just showing us how her body was metabolizing the hormones. You're seeing good amounts of progesterone that are being created here. You're also seeing that a couple of her estrogens are in the speed dials, and really anything between the stars is still considered what's normal, except for this one, it's on the lower side. When our body metabolizes testosterone to estrogen, or our body is taking this estrogen that it's creating from the ovaries and the adrenal glands, there are certain pathways that are beneficial. And then there are pathways of estrogen metabolism that are not great for us. For example, these kinds of tests can't be done through the regular labs right now, like Quest or LabCorp. So you're typically using companies like Dutch or even Genova, and there may even be a few others now that offer it. But here we're looking at how her body was metabolizing this estrogen. You're also seeing that there's arrows here showing that some of the testosterone that she was creating was also aromatizing or becoming small amounts of this estrogen. I always like to think of this little section as train stops and train tracks. And you can see that some of the arrows are going in different directions. Some of them are going back and forth. Ideally, what we want is we want to see this reverse L pathway to be the ultimate pathway. And this is the pathway that then exits this estrogen out through the digestive tract, out through the liver, breaking it down there, and then out through the gut. And so this reverse L, we typically want to see high amounts of this in terms of how this hormone is being metabolized in her body. And I usually like to see this close to around at least 80% or more. And then I'm also looking at these other pathways, like this, in red, for example. If somebody is creating high amounts of this estrogen, this is also where something like the supplement that you love, diindolylmethane, can also be helpful, because it helps our body shuttle things down the optimal pathway, which is the reverse L. It's not just enough to know that the level is high. I'm also looking at how your body was metabolizing it here. And ideally, we want the 4-OH metabolite of estrogen to be on the lower side, usually at least less than 10%. And for patients who are struggling with symptoms, maybe even less than that. So a test like this, if she just got the regular labs from the regular doctor, you might just say, oh no, the testosterone is normal, you don't need to do anything about it. Or the estrogen and progesterone levels in blood, they look like they're in normal ranges. But it was important for us to see how she was metabolizing it, because now I'm seeing that there are some blockages in her train tracks. Here, you can see that this particular enzymes, COMT and methylation, that correspond to her genetic predisposition, this arrow and this arrow, not the same. Basically, her body is producing a lot of this 2-OH estrogen, and then it's getting stopped at the train track, and then it's not able to exit out of her body that well. And because these arrows look like this, and this is on the lower side, I know that this is something that we need to work on. There are foods that help this because there are certain nutrients that do it. There is also certain supplements that are actually really valuable to help support this. We know that this particular enzyme responds to magnesium and B6. And what is one of the supplements that's on your list? Magnesium, right? So we know that to help support how well her body can shuttle out this estrogen, that is really important. For a lot of patients that have methylation problems, they need active B12 and active folate to help support that. And sometimes we do need to add in some additional supplementation so that the train can keep moving, okay? So that we don't have stops in the train tracks. I also think that this estriol being a little on the lower side for her is probably because her body needed more support with detoxification. So this means focusing back on the liver, focusing on how well she was sweating, focusing on what those workouts were like at the time, and having more of a conversation around lifestyle. So this is an example of a way that regular labs may not be enough, and using some additional testing can help us with certain aspects of lifestyle and maybe even some additional supplementation that was going to help target and support her PCOS. Here at Love.Life, our team has created an ecosystem where people have access to many different things that help to support patients with different kinds of conditions, whether it's PCOS or not. Not only are they going to see myself or Dr. Anna in functional integrative medicine, they have access to an expert care team that also includes health coaching and registered dietitians and personal trainers and physical therapists and somatic therapists and energetic healers. The list can keep going. And the reason why we bring these people together is because that weaves a very different fabric of care than 15-minute doctor appointments, where you might not get a full-blown explanation of where the root causes of PCOS can exist. We also hold community events like this one, free to the community, to help bring you in, to help teach you about different aspects of care that you may not have heard otherwise. We also have a state-of-the-art fitness center that you will see on the tour, access to infrared and dry saunas, the different kinds of spa and recovery modalities. The list truly does go on. And the reason why I really love what we've created is because people have access to a world that we've thoughtfully curated to include every aspect of health, whether it's emotional, physical, physiologic, you name it.
There we go.
Yeah.
We had gone backwards.
Yeah, I did.
That's okay. Okay.
Cute picture though.
We do have a QR that we'll pull up. So before we do the tour, you can scan it, but you will land on a landing page. So we threw a whole bunch of information at you. Now this gives you practical things that you can take home. So there are 25 recipes, a few gym workouts that you can follow, a guided meditation, and then you also get a replay of tonight's presentation when it's ready. Maybe one or two other things on there. And I will email out the landing page as well. So if you forget to scan it, then don't worry.
All right. So there's an opportunity for us to just have a small little fireside chat, and then you all get to ask questions. I feel lucky because I get the first like stab at questions for Steph, and then you all get to ask. So one question that I have for you is, what prompted you to found and create a coaching program for patients who are really struggling with this condition? Like, why? Tell me why. Tell us why.
Struggling is probably the base of this answer. It felt like the whole PCOS diagnostic process can be confusing and overwhelming and murky, and people just don't know what to do with the information that they've gotten from their doctor. And so I wanted a way to simplify it and allow someone to have step-by-step of what to do. So like really take the thinking out of it, and have the support along the way. So it just felt like there were so many missing pieces, and I wanted to piece those back together.
For a lot of the women that you see in coaching, are they struggling with the same symptoms, or do they have different stuff going on?
So different symptoms, but it's always the same story of, like, I went to my conventional doctor, my labs are normal, they put me on birth control pill and kind of said good luck. And so it's just actually mind-blowing how it's the same story between so many of us. Different symptoms though, like depending on the root causes. So
Yeah.
it varies from person to person, yeah.
How long does it typically take from a coaching perspective to see some meaningful change?
You know what? It doesn't. Like even within a couple weeks, I have people tell me, like I have one client who got her period for the first time in 900 and something days.
Wow.
Or one of my other clients, I posted it on my Instagram story today, but she sent me a picture of her ovulation strip, like her pee strip, and said it's the first time like she's ever even seen lines on there. And
Wow.
so she's only a month in. But yeah, like even just in a couple weeks, which is so important to remember, because I think a lot of times like we can feel so low and it feels like, oh, how am I ever going to get out of this hole? Or like it's going to take so much work. But really within like a few days, few weeks of eating healthy and moving your body right, like you feel so much better quickly.
Your skin looks great, by the way.
Oh, thanks.
I was thinking, I'm like mesmerized by your skin, thinking about that photo that showed, the acne, and then thinking about how you said that wasn't even the worst photo.
Thank you. Someone told me my skin looked good the other day, and I was like, oh my God, you don't even, like, you have no idea how much of a compliment that is, but thank you.
Yeah, and I mean, look, these were labs and tests from 2019. So in my head, I'm thinking all of those years and all of the support and how many doctors you had seen before you came to me.
Yeah, I got diagnosed when I was 16. It was literally 2 decades of me just trying to figure out why I had acne. Like I did everything.
Yeah.
Peels, lasers, medications. I went on Accutane 3 times. Like it was 2 decades and multiple doctors, like more than the 2 that study says.
Yeah.
And yeah, it wasn't until you who actually took the time to dig a little bit deeper.
Yeah, thank you. I think one of the lucky things that I have that I'm grateful for is that I have a lot of time to spend with patients. So it's not 15 minutes, Even at my prior practice to Love.Life, it was the same. We spent a lot of time just talking through the whole history and through the whole case. But for a woman who's been struggling for almost 2 decades, this is a problem. We know that PCOS is not getting the treatments that it needs, which from a foundational standpoint, again, like I mentioned in the slides, it's just not birth control for a lot of women. Maybe that's not enough. I see a lot of people kind of nodding their heads thinking, maybe I'm one of them. So, yeah, those are all the questions that I have. I don't want to hog all the time, and I want to make sure that you all have the opportunity to ask as well. So if anybody is brave enough to raise your hand or ask from a friend or for a friend, you're welcome to.